How good a hospital is Street. Mary Mercy Livonia Hospital. Depends on whom you ask. The Leapfrog Group, a respected nonprofit that promotes patient safety, gave an A to this Michigan hospital. The company Healthgrades named it one of America's best 50 hospitals. But the Joint Commission, the nonprofit organization that accredits hospitals, and U.S. News & World Report omitted Street Mary from their best hospital lists. Consumer Reports gave it an average safety score of 47 points out of 100, citing high numbers of readmissions, poor communication with patients and excessive use of scans. Medicare, which has a new program rewarding hospitals for meeting certain quality measures, is reducing Street Mary's payments by a fraction this year. Evaluations of hospitals are proliferating, giving patients unprecedented insight into institutions where variations in quality can determine whether they live or die. Many have similar names, such as Best Hospitals Honor Roll, America's Best Hospitals and 100 Top Hospitals. Illinois, Florida and other states have created their own report cards. In some places, such as California, there are more than a dozen organizations offering assessments on hospital quality. But those ratings, each using its own methodology, often come to wildly divergent conclusions, sometimes providing as much confusion as clarity for consumers. Some hospitals rated as outstanding by one group are ignored or panned by another. Ratings results from an individual group can change significantly from year to year. We've alternatively been labeled the least safe hospital in Maine and the safest hospital in Maine, said Dr. Douglas Salvador, Vice President of Quality at Maine Medical Center in Portland. And the ratings do not always jibe with the views of authorities who oversee hospitals. For instance, UCSF Medical Center has gotten good grades from multiple safety raters even as California public health officials have fined it $425,000 repeatedly for endangering patients. As the ratings multiply, more and more hospitals have something they can boast about. A third of U.S. hospitals, more than 1,600, last year won at least one distinction from a major rating group or company, according to a Kaiser Health News analysis. In the greater Fort Lauderdale hospital market, 21 of 24 hospitals were singled out as exemplary by at least one rating source. In the Baltimore region, 19 out of 22 hospitals won an award. I worry a lot about these ratings, said Jared Loeb, Executive Vice President for Healthcare Quality Evaluation at the Joint Commission. They're all justifiable efforts to provide information, but at the end of the day every single one of them is flawed in some respect. Rather than enlightening, we may be confusing, not a complete picture of the care. There are so many report cards on hospitals that the Informed Patient Institute runs a website that grades the raters. Carol Cronin, its executive director, said most report cards are not easy for consumers to use. A lot of them don't help users quickly understand which hospital is better than another, she said. But many hospitals are eager to trump these distinctions in their marketing. Healthgrades, U.S. News and Leapfrog not only encourage this but also profit from it by charging licensing fees to hospitals that want to advertise their awards. A hospital cannot buy an award, they must achieve it, Healthgrades said in a statement. Healthgrades and Truven Health Analytics, which publishes the 100 top hospitals, offer consulting services to hospitals that want to improve their overall performances. Jean Chenoweth, a Truven Senior Vice President, said the list doesn't earn Truven any money but it gives the company a lot of visibility. Dr. Andrew Broadman, Chief Clinical Officer at NYU Langone Medical Center in Manhattan, said the fees can be substantial. Healthgrades, which is one we did well on, charges $145,000 to use this even on the website as a logo, so we don't do that, he said. U.S. News is in the $50,000 range. Leapfrog is $12,500. Consumer Reports bars hospitals from using its ratings in marketing, but patients must subscribe to read them online. Others generally provide free access to ratings on their sites. The Joint Commission does not charge hospitals that make its top quality list. The Pew Research Center survey found 14% of Internet users consulted online rankings or reviews of hospitals and medical facilities. Florence Harvey, 70, said when she moved to Washington, D.C., last fall, she picked health plan and doctor affiliated with Washington Hospital Center after reviewing all the local hospitals' rankings on U.S. News website. That was the one that had the best across-the-board ratings, she said. But Harvey may be an anomaly. Dr. Peter Lindenauer, a professor with Tufts University School of Medicine based in Springfield, Mass., said the limited research on rankings suggests they have had very little impact on patient behavior. Patient safety has to be a priority. That's not surprising since many admissions, such as those due to a heart attack or car crash, have an immediacy that rules out comparison shopping. Also, researchers note, many patients defer to their physician's recommendations or go to the hospital where their chosen surgeon has privileges. Still, rating groups say the ratings help keep the pressure on hospital executives to keep quality up. Patient safety has to be a priority 24/7, said Leah Binder, Leapfrog's president. The minute it slips off the priority list, that impacts the rating. The calculations that go into these ratings are complex. Most hospital assessments synthesize dozens of pieces of data Medicare publishes on its Hospital Compare website, including death rates and the results of patient satisfaction surveys. They also examine other sources and use private surveys to create user-friendly lists or grades, which they display on their websites. The Joint Commission looks at how frequently patients received recommended treatments, such as flu shots for those with pneumonia. Consumer Reports examines the numbers of patients who die or are readmitted, infection rates and Medicare patient surveys of their experiences. Leapfrog looks at data from its surveys of hospitals, the consistency with which hospitals followed safe surgical practices and frequencies of infections and some types of patient harm. Healthgrades analyzes detailed Medicare records to find death and complication rates for 27 procedures and conditions. Ratings and ranking programs certainly offer people information they can use to make their hospital selections, but we don't recommend relying on any one of them completely, Jennifer Kennedy, a spokeswoman for St. Mary Mercy, said in an email. None are able to tell the whole story or paint a complete picture of the care that is delivered. The ratings groups believe the public benefits from a multitude of ratings. Dr. John Santa, who directs Consumer Reports Health Ratings, said consumers benefit from different advantages just as they do for cars or electronic devices, and the competition spurs each rating group to get better. We think that's consistent with good science, Santa said. Avery Damarose, Health Rankings editor for U.S. News, agrees. People go to hospitals for different reasons and priorities, he said. I'm not sure there could be a single rating system that can do it all. Some of the hospitals that do the best in the rankings have limited respect for them. Advocate Christ Medical Center in Oak Lawn, Hill, last year received praise from Leapfrog, U.S. News, the Joint Commission, Truven and Healthgrades. But Drive William Adair, Vice President for Clinical Transformation, says the hospital doesn't license any of the distinctions. We're all made a little bit uneasy, to be frank about it, Adair says. Some of these organizations are looking for revenue. It blurs the effectiveness of the ratings processes. Still, many hospitals are happy to use the praise. Dr. Brockman from NYU said, even though there's not a hospital executive who won't tell you that they have a great deal of skepticism about a lot of the methodology, there's not one who will tell you they don't want to be on the lists.